Hi, my name is Zoe Kiefer. I'm a program manager at Canadian Children's Literacy Foundation, and we run a program called Early Words. And today we are joined by two of our doctors who work on the Early Words program in Winnipeg, Manitoba, Dr. Ruth Grimes and Dr. Gina Pagura. Hello.
Hi.
Thanks for joining us. Nice to see you both. When we told you about this opportunity, why did you folks want to join on and start doing it?
I mean, I think all of my colleagues are just very passionate about literacy. The rate of cognitive development and brain expansion is so rapid that certainly starting to do these things early is very important. We know that, reading, language, it's a large part of how we communicate and how kids interact with the world, and is, one of the main parts of child development.
Literacy in terms of, early book exposure, reading, speaking, singing, is actually teaching that child's language. It's teaching and helping them develop their identity, their place in the world, their place within this family, developing those attachments. How do I attach to someone? And really it was a pivotal moment, an epiphany for me several years ago when our Manitoba Pediatric Society had a town hall and we gathered pediatricians, psychologists, and psychiatrists together. At that time, our children's hospital was dealing with a mental health crisis that was actually having an effect on our acute care hospital. And we were having so many teens in crisis admitted to our acute care beds. And we were trying to brainstorm as a group of professionals how to address this. And one of our pediatric psychiatrists said, if you want to have the biggest impact on children's mental health, you need to focus and want to address literacy. And that was a very powerful moment for me. And that's, I think, where the importance of literacy, the long-term life trajectory and outcome, so that our interventions as pediatricians are going to be far-reaching. And that was a big motivator, I think, for me to want to get involved with this Early Words program.
How do families react when you give them a book or start talking to them about reading and literacy?
I can't say I've had anyone be disappointed with receiving a book. Mostly it's excitement, sometimes surprise. Patients, we get to keep this book.
I think the beauty of the program really is also in the quality of the books, and many of the books have been books that I used and read with my children. And so what I really enjoy is when the book generates its own little story in the office.
Great. And now talking about sort of what it's like day to day running this program, how did you find the process of getting ready to start handing out books and giving counseling, like the training as a part of Early Words and the resources? How did you find that process?
The resources provided, the training video, the laminated info sheets were great and had lots of good practical tips on how to talk about things with different age groups, and just good little kind of key phrases that are nice to have on hand to talk about with families.
Being prompted and encouraged to actually go on the learning management system was also a useful, important, really informative and enriching part of the training program for me.
What's your favorite part of putting this into your practice?
I think for me, it's just inspiring a love of reading in kids. I mean, I grew up being happiest snuggled up with a book and in libraries, and it was something that I was just always exposed to. And my mom took me to the library before I could walk, probably. So being able to inspire other families to do that and really see the joy and the interaction within the family and the relationships that develop around reading, as well as all of the outcomes that we've talked about that are so important, is really just, it's just a pleasure to be involved with that and to see kids get excited about reading and hopefully make a difference for them in the future.
That love of reading has just translated. It opens up so many worlds that even if one is, disadvantaged through, socioeconomically or what have you, you can explore your world through reading. the world is open to you. All you need to do is open a book. And I think to build that interest can really be life-changing. And that's what I enjoy about establishing and being part of this program, is it's opening the world to young eyes.
I would say 100% get involved. It's been nothing but rewarding for myself and my colleagues to be able to continue doing this work with kids and to be able to give them something. Like I said, it's so wonderful to add that piece of it that really brings home what we're talking about. It's one thing to say it, but then to give them the tools to actually do it is another thing entirely.
The language development that then leads to the reading, that then leads to that kind of, academic and social emotional achievement is so crucial. And when you teach a child to read, you're enriching that relationship between the parent and child, and you're enriching that family. That is an awesome responsibility, but a privilege that I think every physician should take wholeheartedly and take advantage of. So it has been a great program to be involved with, and I would encourage every practice to do that.
Well, I just can't think of a better way to wrap up with that. Thank you so much. It was great to see the both of you.
Lovely. Thank you.
Thank you.